Dr. Heischka, you talked about the need for the federal government to declare a national public health emergency, something that the NDP has also been calling for. And we saw the federal government recently, they just hosted a summit on auto theft. But they haven't done anything like that on this crisis. And you talked about you've lost more lives in Alberta due to the toxic drug crisis than you did to COVID. Yet we saw the spending and the effort from the federal government is less than 1% of what they've spent in terms of responding to the toxic drug crisis than they have COVID. Do you believe the federal government is doing enough in terms of rolling out a plan with a timeline and resources? And what do you believe is necessary to respond to this crisis in the short term?
Yeah, I don't want to get bogged down in debates over the specific legal mechanisms of declaring an emergency or not, but I think obviously we need to recognize this for what it is, a public health emergency, and we need to substantially increase federal spending. And I think we also need to not only do that, but look at currently 60%, almost 60% of federal spending for the Controlled Drug and Substances Strategy is going towards law enforcement efforts. And I think we need to be looking to see if that is getting us the best value for money in terms of improved population health outcomes. We are not resourcing enough provincially or federally, social programs, healthcare, and a whole host of other options that can potentially be more effective at supporting people to stay alive and achieve recovery and get well. Beyond that, I think in the short term, there's a lot of things the federal government could do immediately to try to bring down the death rate. First and foremost, please do not cut the existing funding to safer supply programs.